Urinary diversion. Urinary diversion is a surgical procedure to reroute urine flow from its natural pathway due to various medical conditions. Indications. 1. Malignancy, bladder cancer, most common indication, urethral or pelvic cancers involving the urinary tract. 2. Neurogenic bladder, spinal cord injury, multiple sclerosis, spina bifida. 3. Chronic infections or inflammatory diseases, interstitial cystitis, severe refractory urinary tract infections. 4. Congenital anomalies, bladder exstrophy, posterior urethral valves. 5. Trauma, severe pelvic or urethral trauma. 6. Severe incontinence, after failed conservative and surgical treatments. 7. Radiation cystitis, or complications following pelvic radiotherapy. 8. End-stage bladder dysfunction, non-functioning bladder, or severe vesicoureteral reflux. Types of urinary diversion. 1. Non-continent, incontinent diversions. Ileal conduit. A segment of the ileum is used to create a conduit for urine, draining into a stoma with an external collection bag. Ureterostomy. Direct drainage of ureters to the skin. 2. Continent diversions. Orthotopic neobladder. A reservoir created using bowel tissue that connects to the urethra, allowing voluntary voiding. Continent cutaneous diversion. Internal reservoir made from bowel tissue with a stoma that requires catheterization for emptying, e.g., Indiana pouch. 3. Temporary diversions. Nephrostomy, drainage directly from the kidney via percutaneous tube placement. Ureteral stent, internal stent bypassing obstruction temporarily. Complications. Early complications within 30 days. 1. Surgical site complications, wound infection, stomal complications, e.g. stenosis, infection, ischemia. 2. Urinary issues, urine leakage, obstruction, ureteral strictures. 3. Infections, urinary tract infections, UTIs, pyelonephritis. 4. Gastrointestinal problems, ileus, bowel obstruction, or anastomotic leakage. Late complications. 1. Metabolic disturbances, hyperchloremic metabolic acidosis due to bowel tissue reabsorption of electrolytes, electrolyte imbalances, hypokalemia, hypernatremia. 2. Kidney issues, hydronephrosis, renal deterioration due to obstruction or reflux. 3. Stoma problems, stomal prolapse, retraction or hernia, peristomal skin irritation. 4. Reservoir-related issues, continent diversions. Stone formation, reservoir rupture or fistula, difficult catheterization. 5. Incontinence, neobladder, daytime or nighttime leakage. 6. Malignancy risk. Rarely, malignancies in the diversion or stoma may develop long-term. Psychosocial complications, body image issues, social isolation, sexual dysfunction. Early diagnosis and management of complications, along with patient education, are essential for optimal outcomes.